Have you ever wondered about the importance of postoperative care after sleeve surgery? How crucial it is to ensure a smooth recovery and optimal results? Sleeve surgery, a highly effective method for weight reduction and relief from obesity, needs to be followed by a series of postoperative care steps. These steps are sometimes as important as the surgery itself. Therefore, after undergoing weight loss surgery, individuals are keen to adhere to appropriate postoperative care. One of the primary questions that arises is about rest and sleep after the surgery. After sleeve surgery, it's essential to rest adequately. This is a critical question that many patients have. Patients who have undergone sleeve or bypass surgery are required to walk around approximately 3 hours post-surgery. Walking significantly and resting minimally in the initial days post-surgery is crucial as it plays a significant role in reducing the risk of postoperative embolism. However, while the individual is in the recovery phase post-surgery, it is important to know how to sleep properly. Why does the way one sleep after sleeve surgery matter to some? It's natural for some to worry about their sleeping position post-surgery. Some may think that the way they sleep might cause the stitches to open, or incorrect sleeping positions might affect the rate of postoperative complications. So how should one sleep after weight loss surgery? The good news is that during recovery post-sleeve surgery, you can sleep in any position that you find comfortable. However, it's recommended to avoid sudden movements in the initial hours post-surgery. It's best to lie flat for 2 to 3 hours post-surgery. Afterwards, you can sleep in any position you find comfortable, whether it's on your back, side, or stomach. The only important thing is to avoid sudden movements while changing positions. If you feel any pain post-surgery in a certain sleeping position, gently change your position. Here are some tips for better sleep post-sleeve surgery. 1. Try to be more active and rest less. Where you sleep after sleeve surgery doesn't hold much significance. Try to be in a semi-sitting position on the first night post-surgery. When liquids are started for you, try to abstain from drinking liquids 1 hour before sleep. Wearing compression stockings doesn't hold much importance during sleep. In summary, post-operative care is as important as the surgery itself. The way you sleep after sleeve surgery doesn't hold much significance. Therefore, it's recommended not to stress about it and sleep in any position that you find comfortable. The way you sleep won't affect the probability of post-operative complications. However, listen to your body. If any position causes discomfort while sleeping, gently change your position. If there are no sudden movements, there's no threat. Therefore, sleep in any position that you find comfortable. In this discussion, we've navigated through the importance of postoperative care after sleeve surgery, explained the step-by-step process, and hopefully dispelled some common concerns about sleep and rest during recovery.
How do we navigate the labyrinth of postoperative care after gastric sleeve surgery? The first thing to remember is that postoperative care begins with understanding what to avoid. Drinking straws, carbonated beverages, chewing gum, and ice might seem harmless, but they can introduce excess air into your surgically created pouch and cause discomfort. Similarly, sugary foods and beverages and fruit juices should be off your menu. Now, we all love a good slice of bread, but it's typically recommended to steer clear of it for the initial 6 to 8 weeks after surgery. However, after around 7 to 8 weeks, you should be able to resume a normal solid food diet. Physically, patients are restricted from lifting objects over 10 pounds for the first 4 to 6 weeks after surgery. Sexual activity is also restricted for the first 2 to 4 weeks post-surgery. As for personal hygiene, showers are okay beginning the day after surgery, but baths and swimming are off limits for 2 weeks. It's important to note that certain foods should be avoided after bariatric surgery. These include greasy, high-fat foods, heavily seasoned or spicy foods, sugar alcohols such as erythritol, glycerol, mannitol, sorbitol, and xylitol, and even foods reheated in the microwave. Now you might find yourself feeling hungry even after getting sufficient calories, protein, or fiber. This could be a sign of dehydration. Our bodies can sometimes confuse thirst with hunger, so it's crucial to stay well hydrated after your procedure. So, to summarize, post-operative care after gastric sleeve surgery involves a careful balance of what to avoid and what to incorporate into your daily routine, steering clear of certain foods and beverages, gradually reintroducing solid foods into your diet, refraining from heavy lifting and sexual activity for a few weeks, and staying well hydrated are the key points to remember.
What is the best way to care for yourself at home after a gastric sleeve surgery? This is a question that might be lingering in the minds of many. Firstly, it's vital to understand that the initial weeks following a gastric sleeve surgery are crucial for your recovery. The first step in your home care routine should be to avoid the use of drinking straws, carbonated beverages, chewing gum, and ice, as they can introduce excess air into your surgically created pouch and cause discomfort. Additionally, it's important to steer clear of sugar, sugary foods and beverages, fruit juices, and caffeine. These substances can cause unnecessary complications and delay your recovery process. By the 7th or 8th week, you should be able to resume a normal solid food diet. However, it's important to remember to avoid certain types of food such as bread for the first 6 to 8 weeks. Heavily seasoned or spicy foods, greasy, high-fat foods, and foods reheated in the microwave should also be avoided. In the post-operative period, it's essential to be mindful of your physical activities as well. Lifting objects over 10 pounds is restricted for the first 4 to 6 weeks after surgery and sexual activity for the initial 2 to 4 weeks. It's also important to remember that showers are okay beginning the day after surgery, but baths and swimming should be avoided for 2 weeks. Feeling hungry after eating is a common concern among patients. This could be due to your body confusing thirst with hunger. Therefore, staying well hydrated after your procedure can help avoid this confusion. For those who enjoy caffeinated beverages, it's best to avoid caffeine completely for the first 3 to 4 weeks. After this period, you can discuss with your doctor or dietitian on how to safely reintroduce these drinks back into your diet. As you progress towards the 6th to 8th week after surgery, you can start eating regular foods. However, it's essential to maintain a balanced diet that includes lean, protein-rich foods, and foods and drinks that are low in fats and sugar. Another key point to consider is to avoid drinking liquids with meals. Instead, sip liquids between meals and wait about 30 minutes after a meal to drink anything. This is to avoid a condition known as dumping syndrome, which can cause nausea, vomiting, dizziness, sweating, and diarrhea. Taking vitamin and mineral supplements daily as directed by your healthcare team can also contribute to a smooth recovery. And remember, always chew foods thoroughly to a pureed consistency before swallowing, once you progress beyond liquids only. Finally, after about 15 days post-surgery, you can gradually start going back to work. In conclusion, the road to recovery after a gastric sleeve surgery involves a well-rounded approach that considers diet, physical activity, and overall lifestyle changes. It's about being mindful of your body's needs and responding appropriately. Remember, each step you take towards your recovery is a step towards a healthier you.